to invite somebody who has been the mentor of almost everybody who says that they are a spine surgeon, Dr. 𝐤𝐡𝐞 𝐒𝐲𝐽. He actually doesn't need an introduction. His topic doesn't need an introduction either, but it is the growth. We've seen the growth. First, you start with surgery, having a, then you do research, then you do teaching. But then what comes right on top, the icing on the cake and the cherry, is what you can give back to society. And there is no better example than Dr. Bhojraj and his social initiative.
Thank you. Thank you everyone and the organizers, Dheeraj, for getting me to WIROC after many years. The topic, I am here to represent the Spine Foundation, which is a social enterprise since '98. We are in the 27th year, and the topic has been spoken at the Young Surgeons Forum, Veteran Surgeons Forum, as well as Kathra. So when I was given 14 minutes to talk about it once again, I decided to skip slides. This is the only slide which is going to be there. And I devised 14 questions which you may have about the Spine Foundation and try to answer them in a minute so that I complete 14 minutes. So what is social responsibility? Aristotle said that man is a social animal, and hence everything he is today is because of the society around him. And hence it becomes imperative for him to give back to the society what has made him. And that's returning or giving back is the responsibility, a social responsibility. And it's not a duty, it's a willful embracing the social responsibility which is important. Now, why spine care? Is there a real need, or just because you are a spine surgeon you want to do spine for the society? No. 70–80% of our population still lives in rural India, and they are unreached and underserved. And because of the increasing lifespan, and as we just heard, osteoporosis, spine issues are on the rise. And there are multiple studies coming up that soon, because of the longevity and conquering of fatal diseases, spine issues are going to be at the top of the burden of diseases. There is also no private insurance, the people are paying from their pocket, and there is a term called CHE, which is a catastrophic health expenditure, which brings a person much below the poverty line if he spends on a spine issue. And hence, it's imperative to reach out to those who do not have the means and offer them a comprehensive spine care. The next question is, how do we identify these needy areas? If you step out of a metro, you will find a person with a spine issue which is not attended. Either he is not aware, or he can't afford it, or there is a lot of apprehension. So we normally identify NGOs or NPOs because that's where they have already done the research and identified patients. We normally work out of government civil hospitals or medical colleges because that's where the poor man reaches out. Sometimes trust and charitable organizations where we practice the spine care. We try and avoid corporate setups and private setups because there the filtering becomes very difficult. You go all the way from Mumbai to a place where a patient who would have otherwise come to Mumbai, who can easily afford, seeks your help, and you compromise on your reaching out exercise. The next question is, who does it? It is definitely not a one-man show. And at the Spine Foundation, we have a team of almost 40 to 50 qualified spine surgeons. And how does this happen? It's through a fellowship program which we run. A fellowship program runs for 24 months, and each fellow is usually selected from outside the metros. And each fellow is rotated through a system, and he is meticulously and very cleverly sensitized to the concept of the foundation. So when he goes back, he is not only a well-endowed, qualified spine surgeon to be at the top in some corporate hospital, but he signs up for weekends to be part of the foundation. And this strength is ever increasing, as you would imagine. Presently, we have 45 such spine surgeons who have signed up for our projects. Next is the question of the number game. There is a number game of 80, 20, 15, 10 and 2. What does this mean? Whenever we reach out to 100 patients in a rural village setting, 80 of them do not need surgery. They need counseling. They don't even need investigations. So that's the positive part of it. Only 20% are the ones with red flags and who need some sort of evaluation and investigations. Out of them, maybe 15 are advised surgery, out of which 10% agree to surgery, and out of this 10, maybe 1 or 2 may need to be transferred to a big center for advanced surgery, such as complex deformities or CV junction. So it's a very positive game, because for each patient operated, you are actually serving comprehensively 100 such patients. What is the 5-filter concept? We have devised a 5-filter concept where the first filter is the community health worker, in touch with the community. Next is the PHC doctor. Third is a rural hospital. Fourth is the center which we set up in the rural setting, where we travel and set up surgical camps. And finally, the 5th filter is a center in urban India. For us, it is the 𝐕𝐸𝐧 Municipal Hospital, where we get patients at our cost, along with one relative from any remote area, to do complex cases such as CV junctions or complex deformities. The various links in the change are right from the community till the donor. In between, you have community health workers, PHC doctors, rural health hospital, consultants, anesthesiologists, rehab expert, and finally the donor. So that's the gap, or that's the change between the donor and the community. Who funds this activity? Normally through donations, government health insurance schemes. Over the last 27 years of the foundation work, our costing has become more effective, because all the money the foundation used to spend is now spent by government schemes, health insurance schemes like the Ayushman and the others. Then we have the CSR funds, and nowadays we have a concept of linking a donor directly with a project. So someone will adopt a project, and finally the undesirable out-of-pocket expense which we try to avoid. What are the common roadblocks? Someone was asking me in the morning, what are the difficulties? The commonest roadblock is at the host level. We identify a place, we know there is a needy population, but the local, since we prefer government hospitals and civil hospitals, there is a big block, because there are people who want to do a 9 to 5 job and enter practice after 5. They are not keen to do anything extra. So we have found ways to overcome that. We sometimes get pressure from the politicians, sometimes we win their hearts, but ultimately that's the main block. The second block is lack of investigations. In Bhawanipatna, Orissa, the nearest MRI was 350 kilometers away. And in Gadchiroli, where we started almost 21 years ago, the nearest MRI was in Chandrapur, which was 160 kilometers away. But with time, things are changing. We are also exploring possibility of a mobile MRI machine. Recently, we had a meeting with one guy from IIT in Bangalore. The next question is, where do we do it? How do we identify the locations? We not only cater for the rural poor, we also cater for the urban poor. And fortunately, we were lucky to set up our unit at the 𝐕𝐸𝐧 Municipal Hospital 2009, so almost 16 years ago, and which is doing great work. And we not only deal with, as you know, in Mumbai, you have a lot of migrant population who cannot avail of state insurance, and they are workers. If you see the coastal road, the metro, none of them is from Maharashtra. They are either from Jharkhand, Bihar, UP, and they need the outreach. Coming to the rural poor, our work started, as I mentioned, 21 years ago in Gadchiroli. And from doing only camps for the first 4 years, we then switched to doing surgical camps 4 years after we started evaluating the population. And today, 21 years later, we have come to a stage where we go every 3 years and do at least 25 to 30 surgeries in 2.5 days. Looking at this successful model, the government of Maharashtra, MUHS, approached us and requested us to start this program in the medical colleges, and we replicated it in 4 medical colleges. And now, as of yesterday, we have 29 centers all over the country, including the northernmost area of Uttaranchal, where we service the Himalayan Pahadi area tribals, and in the south in Sitilingi, which is a tribal valley servicing the Tamil Nadu tribes. Coming weekend, we are going to Purulia, which is in West Bengal, completely tribal. And last week, we did Anandpur, which is in interior Madhya Pradesh tribal area, just to name a few. Who spreads the good word and awareness? We have a very strong social media presence, and that's the barcode. If you scan, you will get onto all possible social media platforms, including the website, the Insta, Facebook, Twitter, YouTube, and you could get connected with us in multiple ways. What are the new programs in the pipeline? The first one is the TSF, the Spine Foundation School Screening Program, which we have initiated in municipal schools in Mumbai. Then there is a volunteership program. We have approached the medical colleges and we are recruiting volunteers to take part in the TSF activities, either in research or camps, and we have 70 plus volunteers registered with us in a short time. Then we are trying to do artificial intelligence driven community projects. The first pilot project has just concluded. We are not yet out with conclusions, but that's the future. Especially in areas where the language is a problem, we could have an AI questionnaire on the phone in Assamese or Bengali language, and depending on the feedback, we could register and spread awareness. Then we have a very unique program for tribal youth called as the Physiotherapy Assistant Training Program, which encourages the young youth to get into areas like, when I say 80% do not need surgery, they need good rehab, and that's where we have devised in Gadchiroli a physiotherapy training module, which is a complete 3-month program where we train and they go in the villages and do the job. What is the future vision and dreams? Spread to each taluka, district, state, and all over the country. Presently we are in 29 centers, but we hope to spread out. Out of the 50 to 54 weekends in a year, we are almost out 42 weekends. And at any given time, on one occasion, we had 3 camps going on at the same time. We also had one camp in Africa, Burundi, where 2 people from our unit did a camp where we identified 40 cases. So the last word is on Gita. As you know, Gita speaks about Gyan Yoga, finding purpose, Karma Yoga, doing action in the direction of the purpose you have found, and finally Bhakti Yoga, which means doing it with complete devotion. So that's Gita Yoga or Gita Gyan for you. And the last line is very important: without expecting its fruits or acknowledgement or credit. Thank you.